Hello, I am recording chapter 27's lecture as we have been doing with these body systems. It just seems to be working out better. It seems to be more conducive to record the lecture, and that way we can utilize our live Zoom time to cover the review and address any questions and answers that need to be addressed. So chapter 27 is the musculoskeletal system. It begins on page 417 in the textbook, and the material for the first slide is actually going to begin on page 418. The figure 27-1, again, is on page 418 in the textbook. And this is a diagram showing different types of muscles. We have the skeletal muscle, cardiac muscle, and the smooth muscle. And you can see the differences there between the three. So anatomy of the muscles. Skeletal muscles attached to bones enable the body movement, kinetics. They're voluntary movements. They're striated in shape and contain multiple peripheral nuclei. Heart muscle is made of cardiac muscle called myocardium. It contracts rhythmically, coordinated by transmission of electrical impulses from the nerve to muscle fibers. Smooth or visceral muscle is attached to or lines other organs such as the stomach, intestines, lungs, and body vessels. The muscle action. Actual work done by thick and thin filaments. Thick filaments made of protein called myosin. 300 molecules of myosin per thick filament. Thin filaments are made of 3 proteins, actin, tropomyosin, and troponin. Troponin. Maybe saying those slightly incorrect. I apologize. Look like 2 strands of pearls twisted around each other and together make up the regulatory protein complex. Functions of muscles: providing movement of and within the body through contraction. Large movement is like running or walking, where fine movement would be more like smiling or wincing. It's stabilizing the joints, maintaining body posture, producing about 85% of the heat within the body to maintain body temperature. Figure 27.2, the long bone, can be found on textbook page 419. So the bones starts at the bottom right corner of page 418 and very quickly moves over to page 419. A newborn has 300 soft bones that fuse into 206 adult bones. Baby bones are cartilage, which means that they are soft and flexible. As calcium is deposited over about 25 years, cartilage hardens into bone. After cartilage hardens, bones can no longer grow. We have 5 categories of bone. And these are numbered, again, starting at the bottom right of page 418 and then moving over to page 419. So the first are the flat bones. These are generally more flat than round. Examples would include cranial bones and rib bones. Number 2 is irregular bones. They have no defined shape. Examples would be the scapula and the vertebrae. Sesamoid bones have cartilage or fibrous tissue mixed in. They're found in the joints. They help reduce friction and enhance joint movement. Example would be the patella, which is the kneecap. Short bones is where we've moved over to page 419. These generally are cube-shaped. Example would be carpals of the hand. Long bones, the most common bone, are divided into 2 areas. Epiphysis, the rounded end of the bone, and diaphysis, the main shaft or central part of the bone. Examples of a long bone would be the femur of the leg. Bone marrow, this is the bottom right-hand side of page 419, is a gelatinous substance inside the bones. We have red marrow, It is red, jelly-like substance that contains blood cells, usually found only in the sternum, vertebra, ribs, hip, clavicles, and cranial bones. And yellow marrow, which is a fatty substance that replaces red marrow in the long bones of adults. It does not produce blood cells. It has fewer pluripotential hematopoietics or stem cells, which are inactive, and it contains more fat and fewer erythrocytes. Functions of the bones begins on page 420. They provide framework or foundation of the body, support body against pull of gravity to maintain upright position, protect internal organs, protect the internal organs such as the heart, lungs, brain, liver by enveloping them in a cage, so to speak. Allow exchange of nutrients and waste products via tunnels within the bone's living tissue. The bones also allow exchange of nutrients and waste products via tunnels within the bone's living tissue. Components of a mechanical lever system that works with the muscular system to allow movement. Bones also store nutrients such as calcium, phosphorus in the bone marrow. Bone releases calcium to maintain adequate supply for metabolic needs. Excess calcium is stored in the bone matrix. Dynamic process goes on continuously to maintain homeostasis. And figure 27.4 shows you the skeletal, or shows you the skeleton, and they have a number of these bones labeled, and they also give you an anterior and a posterior view. This is found on page 421 in the textbook. So now we're going to look at some of the musculoskeletal disorders. The first one we are going to look at is osteomyelitis. This is a bacterial infection inside the bone that destroys bone tissue. And this is page 420, by the way. Original site of infection is frequently in another part of the body. Infection spreads to the bone via the blood, usually caused by Staphylococcus aureus, and treatment with anti-infective agents. Osteoporosis, which is bone brittleness due to lack of calcium, is prevalent in postmenopausal women because of estrogen deficiency. Paget's disease changes normal process of bone growth. Bone breaks down more quickly and grows back softer than normal bone. Bones bend and break more easily. Treatment of weak, fragile, or soft bones would include vitamin D and mineral calcium replacement therapy, estrogen replacement therapy for osteoporosis in women, biophosphates and calcitonin for both Paget's disease and osteoporosis. Table 27.1 details of bone resorption inhibitors. This is found on page 422 of the textbook. And table 27.2 begins on page 422 in the textbook and carries over to page 423. It is a comparison of health benefits and risks of drugs used for osteoporosis in menopausal women. So back to our musculoskeletal disorders. The next one we're going to look at is called bursitis. Sorry, I was just looking for where it begins on the textbook. And bursitis begins on page 424 in the textbook. Bursitis is an inflammation of the bursa, which is a small fluid-filled pouches between bones and ligaments or muscles. We have tendonitis, that is inflammation of the tendons, which are cords of connective tissue that attach muscle to bone. Myalgia refers to muscle pain. Anemia is the failure of the bone marrow to produce red blood cells. Most common cause is lack of iron, also caused by blood loss or hemolysis. Lack of oxygen inside the erythrocyte leads to fatigue. Leukemia begins when DNA of white blood cells is damaged or mutated. Damaged DNA is copied and passed on to subsequent generations of cells. Abnormal cancerous cells do not die off like normal cells. They multiply unchecked within the body. The next we'll look at arthritis, which has several different types. Rheumatoid arthritis is a progressive autoimmune disorder characterized by inflammation of cartilage around joints, leading to thickening and hardening of the synovial fluid. Osteoarthritis is a progressive disease characterized by the breakdown of joint cartilage. And gout is on page 425. This is painful joint inflammatory disease caused by crystals of uric acid in joint synovial fluid. Arthritis treatment. Disease-modifying anti-rheumatic agents or DMARDs, gold compounds, penicillamine, sulfasalazines, hydroxychloroquine, leflunomide, and some secondary lines of therapy would include NSAIDs or steroidal anti-inflammatory drugs. Table 27.3, anti-rheumatic agents, can be found on page 426 in the textbook. Treatments of gout, also on page 426, or it begins on 426, very quickly moves to 427. So again, the treatments of gout would include colchicine, anti-inflammatory analgesics, preventative treatment or prophylactic therapy, hypouricemic agents, and uricosuric acid agents, sorry. So table 27.4 shows a comparison of drugs used to treat gout. It can be found on page 427 in your textbook. Musculoskeletal disorders continued. Now we're moving into inflammation. Inflammation begins in the bottom right corner of page 427 and very quickly moves over to page 428. So inflammation is a normal response to injury. Symptoms include redness, edema, which just means a swelling, warmth, pain, loss of function, or immobilization. So treatment of inflammation, we are on page 428 now, would include salicylates, which inhibit synthesis of prostaglandin, corticosteroids, which inhibit movement of macrophages and white blood cells, non-steroidal anti-inflammatory drugs, commonly referred to as NSAIDs, will inhibit or block enzymes that synthesize prostaglandin. Cyclooxygenase 1 or COX-1 builds and thickens mucosal lining of the stomach. Cyclooxygenase 2 or COX-2 contributes to inflammation. Table 27.5 is found on page 429. It details the salicylate drugs. And I apologize for my enunciation of some of these things. Table 27.6 is also found on page 429. It details examples of NSAIDs. That's the non-steroidal anti-inflammatory drugs. And as you can see, that is quite a large table. It carries over to page 430 in the textbook. So next we're going to look at skeletal muscle relaxants. Once again, just trying to find my place in the book. Page 431 on the right-hand side, sorry. The skeletal muscle relaxants are used to relax specific muscles in the body. They reduce discomfort in strains, sprains, and other muscle injuries. May also be used in spastic diseases like multiple sclerosis or cerebral palsy. They're used to help relax patient or specific part of the body prior to surgery. They act either in the central nervous system or directly on the muscle to produce their relaxant effects. So table 27.7 is found on page 431. Skeletal muscle relaxants are detailed there. And it does carry over to page 432. Table 27-8 is on page 432. This details agents for surgical procedures that provide temporary muscle paralysis. Multiple sclerosis. This is found on page 433 in the textbook. Multiple sclerosis is an autoimmune disease characterized by multiple areas of inflammation and scarring of the myelin in the brain and spinal cord. Symptoms may include fatigue, weakness, spasticity, balance problems, bladder and bowel control problems, numbness, vision loss, tremor, and vertigo. Muscular sclerosis treatment includes steroidal anti-inflammatory agents, synthetic adrenal glucocorticoids, and corticosteroids such as betamethasone, dexamethasone, methylprednisolone, prednisone, and prednisolone. Table 27.9 details examples of drugs that interact with muscle relaxants, and that is found on page, it begins on page 432 and finishes on page 433. Spastic diseases is on page 433. The first that we will, or the next one we'll look at, we've already looked at multiple sclerosis. Now we're going to look at cerebral palsy. This is affected person has poor control of the brain, muscles, and joints. It is caused by injury to the brain before, during, or shortly after birth. Characterized by inability to fully control motor function, particularly muscle control and coordination. Treatment includes physical and occupational therapy, drugs to prevent seizures and spasticity. Table 2710 is found on page 433 towards the bottom right corner. These are drugs used to treat seizures associated with cerebral palsy. Table 2711, also on page 433. This details drugs used to treat spasticity associated with cerebral palsy. And our summary is on page 434 of the textbook. So musculoskeletal system consists of bones and skeletal muscles. There are four main functions: provide a framework or shape for the body, protect the internal organs, allow body movement, and provide storage for essential minerals. Affected by numerous disorders, some cause discomfort and pain, some are completely disabling. And that concludes our lecture for chapter 27, the musculoskeletal system. So I will see you all for the live session. And until then, I hope you have a great day. As always, feel free to reach out to me if you have any questions. If anything's unclear, you're not sure about anything, just simply reach out and we will work through it. Have a great day. Bye-bye now.